Mom, do you have my water?
Yes. You're in constant urgency. You just have to be alert. Is he going up? Is he going down? You're just on a constant roller coaster.
I feel like I'm low. My stomach really hurts.
All right. Yeah, you are dropping.
Thank you, Miles.
You don't want to scare them, but inside, you're panicking, but you don't show that you're panicking.
Aiden is beeping. So right now it's at 69. Aiden, do you want a glucose tablet or you want a juice? Juice, okay. All the time you're on alert, all the time. It's like if you hear a fire alarm all the time. That's what it's like.
That's you when you first got diagnosed.
The doctor came in and he said, what we have here is diabetes. And just out of nowhere, just one day, your life is almost like taken away.
We have to change the pod every 3 days. That gives me insulin.
1, 2,
Counting?
3.
When I'm 4.
You good?
Yeah.
There you go. He's the one who is strong, and he has type 1, but we have it all as a family. It affects everybody.
Mom, you can start going. I'm okay. Usually my brother over there, he helps me test my finger.
I would say the time that I was initially scared was when he was diagnosed. Because as a nurse, I know things. I became very nervous for his future, as well as how am I gonna manage it as a single mom. The second time was when he had his first seizure.
I was very scared, and I didn't know what to do.
T1D is a family affair. We've had to train family members, friends.
What's your blood sugar? Do you know it? Or do you want me to check? Let's check. Alright? So 73.
What we've learned is Aiden can play and he's low. And he's getting lower and lower and lower. And he will continue to play. When he's playing, I'm always like checking every second.
What's your blood sugar? 146. It's good.
Emerson,
What's your number?
I don't know.
where's your phones? You need to go get them.
He wants to go around the block with his brother.
Can't. I don't know what life is like anymore of just that constant fear, that the what ifs. You're constantly worried about the future. Is those highs, like when he woke up and he was in the 300-400s, did that do something to your body? You really go into like a very, very dark place very quickly. We're exhausted.
Yeah.
We're exhausted. And you don't want to say that out loud because that's your child. But being a caretaker to this disease that like just came out of nowhere.
Sometimes I cry because I'm never completely at peace. Brandon, he was diagnosed with leukemia. Now I feel hopeless. I'm dealing with 2 kids who require constant treatment. He sometimes gets fed up doing his pump, fed up with his monitor. A cure for me right now would be calmness, peace, success, that I kept my son alive.
We teach our child like, you're normal, you're normal. Of course, but this isn't normal. You constantly feel like you're just in this horrible nightmare and you're waiting for someone to wake you up with that cure so you can breathe.
It would be good quality of life, a cure. Oh, gosh, I can't even imagine.
It's just,
it was a small group of families like the Sturmans and the Lewises who came together a half-century ago in search of answers. They created the Diabetes Research Institute Foundation to find a biological cure for type 1 diabetes. From targeted immune therapies and next-generation cell replacement to a breakthrough platform designed to help the pancreas safely restore insulin-producing cells, we are closer than ever to a world without diabetes.
You cannot stop until you reach the home run. There is not such a thing like partial success in the search for a cure.